Good evening. I would like to welcome everyone to the 53rd graduation ceremony of the Washington School of Practical Nursing. To get started this evening, I want to introduce a few people here in the crowd with us. On stage with me, I have some of our faculty and staff. I have Ms. Carrie Huff. I have Ms. Heather Foster, Ms. Lisa Kremelmeyer, myself, Chris Redd. Our other instructor, Dina Vitale, couldn't be here tonight, but maybe she's watching, so hello. And we have with us our superintendent of schools, Dr. Jennifer Kephart, and our Four Rivers Career Center director, Mr. Philip King. So, do you guys remember August 10th? How terrified you were the first day of school? You were sitting there almost in tears, kind of like tonight. It's amazing to us how much you guys have grown just in that 1 year. No matter what we threw at you, you guys were able to accomplish that task, and you need to be commended for that, because that was a hard task that we threw at you. This evening marks the end of a long year of notes, tests, linen changes, bed baths, vital signs, med passes, IV starts, and it also marks the beginning of a long career of bed baths, vital signs, med passes, and IV starts. This is your first step, which is what will hopefully be a very exciting, rewarding, frustrating, and fulfilling nursing career. So I'm sure you never thought you'd get here, but you accomplished 80 unit tests, not that anybody was counting, 10 finals, numerous quizzes, hours of pre-planning, standing at the med cart, getting quizzed on your meds. You have made it. Congratulations. I need to thank a few people for us getting to where we are today, and one is our clinical agencies. We couldn't do what we do without our clinical sites. These students can attest the experiences they were able to accomplish in our clinical facilities, so we could not do what we do without them. We also have some individuals that support us in the form of scholarships. So the first one I'll talk about is the Sarah Stoner Alsop Scholarship in conjunction with the Wings Foundation. They give $1,000 to a returning adult learner, and this year that recipient was Max Martin. Max, will you stand? We also have Dale and Beth Gildehouse. They have a $1,000 scholarship in memory of their daughter Stacy. This year's recipient was Katie Rice. Katie, will you please stand? So we want to thank the Alsop family, the Wings Foundation, and Dale and Beth for their continuing support of our program. These students very much appreciate it. Every month, we choose a Student Nurse of the Month, someone that demonstrates professionalism, positive attitude, perseverance. As I call your name, if you would please stand, and if everyone can hold their applause until everyone has a chance to stand. In August, it was Tori Siebert. September was Roxana Bursley. October was Sharmika Watson. November, Roylee Bartell. December, Chloe Gilmore. January, Priscilla Brandhorst. February, Cadence Peck. March, Alexis Jenkins. April, Katie Rice. May, Alex Sullentrup. And June, Max Martin. Congratulations. So something that's very important in our program is attendance. These guys will attest to what happens if you miss a day or even 4 hours, how much we accomplish in that time and how much you have to get caught up on. So to make it all 1,364 hours, that's how many hours we were there this year, to make it all of those is a pretty monumental task. We had 2 individuals that were able to accomplish that monumental task this year, and those are Patty Bachman and Chloe Gilmore. If you ladies would come up here. Good job. So our next award this evening is for Student Nurse of the Year. So we have Student Nurse of the Month every month, but the Student Nurse of the Year is selected by the instructors and some input from our clinical sites for someone on their performance at clinical, their knowledge, compassion in the clinical setting. It was a difficult decision every year. There's so many that was deserving of this award, but this person was always prepared to take care of their patients, went above and beyond to help fellow classmates. They ensured their patients had the best care. We received many accolades from outside clinical sites regarding this person. So this year's Student of the Nurse Year goes to Chloe Gilmore. So our next award this evening is for our high academic achievement. So these ladies and gentlemen can attest to how difficult our curriculum is, our tests, everything that we throw at them. Put it this way, our A in our classroom is a 93, and an F is a 77. So you really have to have a pretty high academic prowess to succeed in this program. So they all have done that, but one person has had a 92% average in all of their theory classes for the whole year. And this year's High Scholastic goes to Roxanna Bursley. Congratulations. Okay, so we have thrown a lot at you guys this year, like your potassium level for your patient when they're on Lasix, what labs to check if they're on Coumadin. You guys probably have this stuff hopefully going through your head right now. How to set an IV pump and to keep it from beeping. These are all things that we have taught you in school, but we've also said we can't teach you everything. There's so many things in the nursing profession that we can't teach you. So here are just a few more of my words of wisdom. They're not mine, but some words of wisdom for you guys before you leave us. So being a nurse is 90% calling, 10% job. Every day you will experience people at their very best and at their very worst. Wash your hands. When you treat a patient, you're treating their family too. You'll go through 4 pair of shoes a year. A comfortable pair is your most important piece of equipment. Faith is medicine, as is laughter, as is music, as are dogs. You've got to be 1 part surgical steel and 9 parts love. Don't be just another nurse. Drink lots of water and wash your hands. A warm blanket can make all the difference, and so can a cool washcloth. You treat 1 patient at a time, and then you treat them completely with all of your attention, and then you move on. Almost everybody likes pudding and cookies. Sometimes you bend the rules. Bent rules sometimes make better ones. Don't forget to nurse yourself. You can't fake compassion. Families need honesty and patients need hope. Wash your hands. Doctors can't do what they do without you, and you can't do what you do without doctors. Kids are going to make you cry, and remember to smile. That's it. We will now present our pins and diplomas.
Patty Erlene Bachman. Royally Christine Bartel. Priscilla Marie Brandhorst. Raylene Marie Brewer. Madison Nicole Brinker. Alina Marie Brown. Roxana Marie Bursley. Michaela Lynn Colbert. Chloe Jean Gilmore. Deborah Ann Harris. Jenny Jane Holland. Oh, thank you. I'm gonna miss you. Shelby Lynn Jarris. Alexis Nicole Jenkins. Anna Marie Kinzel. Donald Maxwell Martin, Jr. Stop. Tabitha Ann Myers. Martha Jane Nelker. Cadence Ashley Nicole Peck. Katie Ann Rice. Janice Nicole Saladino. Victoria Lee Siebert. Alex Bree Sullentrup. Sharmika Watson.
Stop. I would now like to introduce Alexis Jenkins to come and say a few words.
I'm nervous. Okay. All right. Time flies when we're having fun, all right, guys? Let me start out by saying congratulations. We have fought long and hard for the past 11 months, and each and every one of us that have had to overcome many obstacles to be here today. On that first day, walking into class, we did not know what to expect, but we knew it wasn't going to be easy. From the long nights of studying, countless pages of notes, endless ATI assignments, pre-planning, and the dreaded care plans, we have managed to make it. We started out as lost, scared puppies, confused on what a modern corner was, to confidently walking into our patients' rooms, ready to not only apply our skills and knowledge, but to ensure that the individual feels truly cared for. We feared the exams and finals, hoping that wouldn't be the one to take us out, and we overcame the nauseous feeling when it came time for skills checkoff. Each of us have come to learn that nurses wear many hats, and we've managed to acquire a few, such as therapist for the fearful, educator for the confused, and of course, waiter for the hungry. And yet there's still so much more we get to learn out in the field. Now it's finally the day for our instructors to push us out of the nest, and we learn to fly on our own. Scary, right? So I'd like to thank our instructors for steering us in the right direction, providing the tough love that we hated at times but knew that we needed, and instilling that confidence in us to become competent nurses. And thank you to our friends and families for being here today and supporting us through this journey. You believed in us when we certainly did not. And as I come to the end of this speech, I ask that if you don't remember anything that I've said today, to remember this. People will forget what you said, people will forget what you did, but people will never forget how you made them feel. So go out there and show every patient you come across what it means to have a caring and empathetic nurse. Advocate for your patients' rights and question what needs to be questioned. Treat them how you would want your loved one treated. And again, congratulations, guys. We did it. And now I'd like to ask my fellow classmates to rise and join me in saying the Nightingale Pledge. Whoever that is. Nope, you got it? Okay. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous, and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to me, and all family affairs coming to my knowledge in the practice of my profession. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. Okay.
Okay, ladies and gentlemen, I want to present to you the 53rd class of the Washington School of Practical Nursing. Yeah, some of you awards people.
Isn't that how we did it last year?
Yes, it is.
We'll do it that way again.